Hi, my name is Anna Lembke, and I'm a psychiatrist at Stanford University School of Medicine and chief of our addiction medicine dual diagnosis clinic. I'm here to tell you what you need to know about bipolar disorder. First, what is bipolar disorder? Bipolar disorder is a mental illness characterized by extremes of mood in opposite directions, from very happy to very sad. Polar opposites, like the poles on a globe. Extreme highs are called mania. Extreme lows are called depression. Everybody has highs and lows, but people with bipolar disorder experience mood changes that are more extreme and longer lasting than other people and cause significant impairment in function. Symptoms of mania include euphoria, rapid speech, increased energy, less need for sleep without feeling tired, increased spending, increased interest in sex, and religious preoccupation. Symptoms of depression include sad or irritable mood, slowed speech, decreased energy, trouble sleeping, and decreased interest in activities that used to give pleasure. People with bipolar disorder can be psychotic and suicidal at either pole, that is, when they are manic or depressed. Psychosis means hearing voices other people don't hear, seeing things other people don't see, or having thoughts that others find inconsistent with reality. Suicidal means having thoughts of ending our own life. Bipolar disorder is episodic. Between periods of mania and depression, people can feel okay. Second, how do we diagnose bipolar disorder? There are no blood tests or brain scans to diagnose bipolar disorder. The diagnosis is based on phenomenology, meaning patterns of behavior that are similar across different groups, cultures, and periods of time. Not everyone who has bipolar disorder will have all of the symptoms, and people without bipolar disorder can have some of these symptoms. For example, it's healthy and normal to experience moments of euphoria or profound despair, especially in response to life events that would understandably trigger those emotions, like achieving a long-awaited goal or the death of a loved one. By contrast, people with bipolar disorder can have extreme mood fluctuations in the absence of external triggers. Fundamentally, what separates a person with bipolar disorder is the degree of the mood change, the duration of the mood change, and the extent to which it causes harm. People who are intoxicated or withdrawing from drugs or alcohol can look manic or depressed, even if they do not have bipolar disorder, which is why it is not possible to diagnose bipolar disorder when people are under the influence. Third, how do we treat bipolar disorder? Bipolar disorder can be treated through biological, psychological, and social means. Examples of biological treatments include dopamine receptor blockers to treat mania and serotonin promoters to treat depression. Dopamine and serotonin are chemicals made in the brain that may be out of balance when people get manic or depressed. Examples of psychological treatments include talking to a therapist to learn to anticipate bipolar episodes and regulate mood. Examples of social treatments include targeting environmental and behavioral factors that can impact mood, like developing a strong and supportive social network to help manage symptoms, having a regular schedule, especially regular sleep-wake cycles, and avoiding drugs and alcohol. So that's it, what you need to know about bipolar disorder. If you or someone you love has bipolar disorder, talk to a licensed mental health professional. If you or someone you love is psychotic or suicidal, call 911 or go to the nearest emergency room.